This is actually a question for Dr. Luo. So I know right now we have patients that have a KRAS G12C alteration get targeted with sotorasib, but what do you do for your patients that have other KRAS alterations at this time? And are there any clinical trials that you are that you're referring to?
Great question. Can you guys hear me, by the way?
Yes.
I'll make sure, because I turned my camera and video just on. Thank you so much, Dr. Preeshagul and Dr. Desai, for organizing this. So that's a great question. There are actually several clinical trials that are about to open or are opening in individuals with KRAS non-G12C lung cancers. I listed them on my slide, but you can also search for them on the website clinicaltrials.gov. And so one example is I know of a KRAS G12D medicine that's just about to start in clinical trials for lung cancer. If you look it up, you can actually get a sense of what cancer centers might be offering it. There's another KRAS, it's called KRAS multi. So people who don't just have G12C, but also G12D and several other KRAS subtypes, that is also opening up. And so I think the best way to think about this is look at the website clinicaltrials.gov, and then I would engage with your medical oncologist about when is a good time to consider participating in a clinical trial. The pros are for sure trying a medicine that's targeted specific to your type of lung cancer, but the negative is sometimes you have to travel to another center and could be on this medicine for an extended period of time. And there might be certain scenarios where it is appropriate to participate in one of these clinical trials. It's a good time to do so. And then there's other times where it's actually more efficacious to take a medicine that's been tried and true and approved by the FDA. And so I think the best person to talk to about that is your personal medical oncologist about what to think about clinical trials. But they're definitely either opened or opening, and there's multiple other ones that are about to open as well.
And thank you for that. I think that clinicaltrials.gov is a great resource, and I refer my patients there as well.